Good afternoon.
Hello. Can everyone hear us?
Say it again. Good afternoon.
We are so delighted to be here with you to close out this day. I mean, seriously, what a great day. And we appreciate those of you who stayed for a few more minutes of conversation and for policy innovation and insights. The main focus of our conversation this afternoon is going to be AI, because it is a subject that I know you, Representative Morgan, are passionate about, accomplished in, and continuing to work on. But we are going to take some questions, and Bob has graciously said that he'll take questions on other topics, healthcare related, if we so choose. Is that fair to say, Bob?
Absolutely.
Okay, thank you so much. All right, so we will jump right in. Bob, you sponsored the Wellness and Oversight for Psychological Resources Act, and it's a long title. WOPRA doesn't really work for me.
Yeah, some people are calling it Whopper.
Okay, good. I like that. All right. And that legislation passed the House and the Senate unanimously, signed into law by Governor Pritzker last month. Tell us a little bit about the guardrails that law is adding to in Illinois with respect to AI, and really, what did you learn through the process of passing that law about consumers' interaction with AI, what they know about it, and how they use it?
Thank you so much, Laura, and thank you everybody for sticking around. I know it's been a long day. And again, we're going to cover a couple questions. Would love to hear other questions from the audience. I started working on this legislation in the fall of 2024, just about a year ago, a little less, and I had already been working on for a few years the ways that AI was impacting healthcare. And of course, that's a very, very broad topic, that it means a lot of things to a lot of people. There's AI in research. There's AI in note-taking for clinicians. There's a lot of different ways that AI is already playing out. I had been focused and continue to be on the way that AI is playing in health insurance. I was concerned then and still continue to be concerned that AI is being utilized in some ways, sometimes ways that we are unfamiliar, in ways to deny health insurance claims. And I have a lot of problems with that. That's where the legislation in the fall had been going, and then I got a call from the National Association of Social Workers asking if I knew anything about AI therapy bots. And I didn't. And so we started looking into it, and we introduced the legislation in January. And I really didn't think this was going to become the big heater of the spring session, but it did. It became a really, really important issue. And the mic was going in and out. That's better. And you missed everything that was so important that I just said. But we started working on legislation for AI therapy in January, and almost by the week, we started to hear stories, national stories, about how AI therapists, AI therapy bots, were playing a role in behavioral health care and leading to some disastrous, sometimes fatal results. National, international stories, and it became a really, really pressing issue. And this was unusual for a lot of reasons, but one was that Illinois' legislature was working on a bill at the exact moment in time, it's very timely, when this technology was blowing up. And I mean that in the sense that there were millions of people around the world that started to use AI for a variety of sometimes calming, but also real therapy-related uses. And so we started working on this legislation. It passed, and the guardrails are what you alluded to, Laura. The idea that this decades-old concept we have in Illinois, around the country, that a professional that's licensed by the state should be providing the care that they are trained, educated, and licensed for. And an AI therapy bot is none of those things. In fact, it's not a he or she, it's a it. And we're seeing the real true harm there. Illinois was the first in the country to pass the ban on AI therapy bots. Other states have already taken up the mantle. California, Governor Newsom just yesterday signed a very comprehensive package of AI bills that went even further than banning AI therapy bots. It banned AI in healthcare decision-making without a professional. So it really is very timely. It's happening in real time, faster than we can even address it. But that's some of the genesis of it.
Excellent. Well, we appreciate your efforts. We're glad you were successful in that regard and with that bill. But I do understand that the work continues. And there are probably no shortage of bills that are going to be introduced again, and I know you're still doing some work. So can you tell us a little bit more about some of the ongoing work with making sure that Illinois has an appropriate regulatory framework for the use of AI with health insurance companies, other applications within healthcare?
There's so much to do on this topic, and there are equally important questions about when government should not be involved. We got a lot of questions during the spring of whether clinicians would be able to use the AI for note-taking, and they could use AI for their own clinical research and investigations. And of course they can, and of course they will. But those were questions that people were concerned about because, again, when we're creating guardrails, it's sometimes equally important to see what government stays out of the way of so that there continues to be the innovation that the industry as a whole needs and is for the betterment of society. Just in the last 24 hours, I've seen two things. There's some new messaging coming out of OpenAI about the roles that AI is playing in your relationship with AI. I think that's one topic that was not covered here. What should large AI platforms do when they are asked by an adult or a child or somebody in need of behavioral health care questions about self-harm and really delicate, difficult behavioral health questions? What should they say? What should it say as an AI platform if somebody says, I'm thinking about I have suicidal ideation. What should I do here? And should we demand a particular response? What should that response be? These are things nobody has figured out. Yep. So that lays ahead. The other thing that California just signed yesterday was creating a universal reporting of safety protocols. What are your policies and procedures to make sure that you're keeping people safe? I think that's a really positive step. And California, of course, has an outsized role on kind of setting the tone for what technology systems are going to do. And I think Illinois is going to be looking at that as well.
Yep. So I know that we've learned, and we're learning so much so quickly about various applications of AI in the healthcare context. And one of the reasons why so many patients have turned to AI, to solutions that are just readily available, is because of barriers to access, challenges to access, continuing as much work as we've done in this space, continuing stigma associated with seeking services. So what did you hear from constituents, from family, from parents, advocates about access challenges and how AI relates to basically what ended up in the bill?
I heard really consistent things from practitioners, professionals, licensed professionals about the need for this. I also heard a lot from individuals. Literally everybody in this room and anybody who's going to be watching this knows somebody who has had a hard time finding a professional to help them when they need it. Behavioral health care is not a 9-to-5 thing. It is a 24/7 need and can become a crisis at any time of the day. So it was important when we start talking about this bill, particularly as it relates to healthcare, the idea that people aren't going to resort to ChatGPT in a healthcare crisis. It's just not realistic. It's not pragmatic. And so what was important about the legislation is we're trying to regulate the entity, the technology company, the marketing company, the large-scale generative AI systems. And we have to acknowledge that this is a real problem. There are millions of people. You and I are healthcare professionals. We've been doing this a very long time. Laura and I have known each other a long time. We know a lot about healthcare, but sometimes if we need a healthcare professional in an instant, we're going to struggle to find that. We're going to struggle to go online and find the nearest healthcare professional. My wife happens to be with access. Yeah. Who's insured? Who has access? I signed up for a healthcare service. The soonest appointment that was available to me is in February. So if I was in a crisis, that was going to be a problem. So I think we have to continue to look at, there are things we can do and we should do, and we have to be honest about what's happening in real time, that people are going to continue to find whatever is out there to help them when they need it.
Yeah. Well, we have known each other a long time, and I know a lot about how you work on these problems, and you partner, you talk to people, you bring organizations in, you listen to a lot of perspectives. What did you learn about some of the promising some of the applications of AI from the advocates you worked with, from even if people didn't support the bill, what did you learn about some of the bright spots and positive applications of AI going on?
Research to me holds so much incredible potential. We are in this, again, a moment nobody in this room is going to be surprised by, that the challenges at the federal level are going to have downstream impacts on a lot of the things that we've come to know, the processes that we've come to trust. FDA research, pharmaceutical research, startup technology, the federal regulations and guidance around any of that. All of that is complicated at best, right? And AI provides a mechanism to streamline some of that. You know, I think about AI broadly as certainly there are some areas of harm and concern, but there are a lot of ways that is creating a streamlining of opportunity for people. You know, I hear a lot of stories of high school students who've never put together a resume before. And whether I live in Deerfield, whether they go to Deerfield High School, or they're growing up in the south side of Chicago, or they're growing up in southern Illinois, AI provides them a foundation for a really strong resume, which goes to college applications, which goes to job opportunities. And if we can start to stratify and just create a better foundation and equalization, I think AI has humongous potential there. There's a lot of startup technology here in Chicago, a lot of startups that are healthcare or healthcare adjacent. There are a few startups explicitly trying to be AI therapy bots. And so we still get questions today of, well, I have a startup and I'm going to create jobs. I'm going to create a lot of opportunity and wealth and help in healthcare world. So you're not really trying to regulate my business, right, Bob? And no, in fact, that is exactly what I'm trying to regulate if you're trying to create an AI therapy bot. And again, AI is so broad, though, I think we have to continue to take a step back and realize you and I know a lot of people, as we sit here today, that are using AI for a variety of functions. And
using it probably right now.
Right now, to think about how to get home or get to the airport in a few hours or whatever they're doing. And that's okay, and that it can be really, really helpful. And government needs to continue to just gut check and make sure we're not standing in the way of that.
Yeah. Well, veto session's coming up soon. And then, of course, we have a brand new session next year. We expect this is going to be a topic of a lot of a conversation. There's still a lot of discovery. I imagine subject matter hearings, all kinds of things. But where do you see the next frontier for responsible regulation? Where do you think the General Assembly is going to focus its efforts? Where are you going to focus your efforts in this space in the next session?
On AI or healthcare broadly?
Let's start with AI, but
Sure.
then I absolutely want to hear more about healthcare broadly.
I still want to pass this legislation we passed out of the Illinois House. It has not yet passed the state Senate, that will prohibit health insurance companies from denying a claim using solely AI. Real basic concept, but nobody has yet done that. And to me, the problem there is whenever you get away from having a licensed professional, somebody who's qualified to actually look at a claim, make a medical necessity determination, you're literally playing life and death decision making. If you put that in the hands of AI, I fundamentally have a policy issue with that. So I want to pass that legislation. Now that California has set a bar about safety protocols and policies, I think we're going to be looking at that closer. I also think that there are a variety of evolving AI regulatory risks. My colleague Dan Dittich has a bill about national security and AI, and that anyone raise your hand if you've seen Terminator. I think about it almost every day, not to freak everybody out. So I think that kind of stuff is real to consider, because whenever the system of federalism that we have has been, my lifetime, always been focused on let the feds handle an issue. And I think we all would agree that at this moment, that is not something we can rely upon. And I think the state will continue to look at different ways where, whether it's criminal context, we've passed laws already on doxing and impersonation of artists. I think there's a lot more with AI that we have to look at and really start to think through what should we be demanding, and then how do we regulate that?
Yep. All right, now what about more broadly? What's on give us a preview of your priority list.
Certainly the ways, and again, this is by the day, depending on what happens with the federal shutdown, the question about subsidies in the marketplace and healthcare subsidies is going to have some significant impact in the state of Illinois and many of our neighbors and family members.
Yeah.
I did a walkthrough of an emergency room a couple days ago where they're doubling the capacity, and it won't matter if 100,000 people or 200,000 people or 300,000 people lose their health insurance overnight. We don't have the capacity to handle that. And so the question becomes, what help, if any, can we get from the federal government? What flexibility do we have in our rulemaking and our financial situation to be able to fill some of those gaps as a state and live with our values and lead with our values? And I think that will be much harder this coming spring than it's been probably going back to the government shutdown, in Illinois at least, when we didn't have a budget, 2015, 16, 17, when the human services and healthcare impact was so real, and it just hit those that already needed the services the most. And I think we're quickly escalating back to that situation. And it will be a whole new set of challenges because it's coming from the federal government, not from state government.
Yep. All right, I promise this is my last question because I want to get to the audience. But I would be remiss if I didn't talk to you about your work with the SAFER Coalition. You were one of the founding members of a national coalition of state legislators that are focused on an area where you've been a leader, which is reducing gun violence. So can you tell us a little bit about what's going on with that and some of the work that you're continuing to do with that coalition?
Thank you for that. Certainly, this is another area where federal inaction has a real impact on our lives and our communities. Even worse than that, we've had over $150 million in community violence interruption funding that not only has been stopped, but has been clawed back from agencies, many in Illinois, that were doing amazing work. There's a reason why in the last few years we've seen a significant drop in gun violence in Chicago and the broader area. It's not a secret. It's not an accident. It's very dedicated work, very costly investment, not with money, but human capital of people that know how to do this and go into communities where there's a lot of gun violence and reduce that by working with young people who otherwise are going to resort to violence. And that, of course, again, something that's not new to anyone in this room, has a significant healthcare background and impact. Not just the public health impact, but literally in the hospitals when gun violence is an issue that plagues our communities. We created this national coalition of state legislators, and they are from all over the country in red and blue states. Democrats, at this point, unfortunately, no Republicans that have joined. I think that's a sad state of what gun violence prevention means now. It's become a partisan issue. And we have so much work to do. I think we are making some great inroads where we're sharing best practices. What Illinois has done with our assault weapon ban and high-capacity magazine ban and rapid-fire devices is great. And we are sharing that information with other states. But our red flag laws and our firearm restraining orders is not so great. And we have a lot to learn from states, including, believe it or not, Florida is doing an extraordinary job with red flag laws that we can learn from and do better to help our community and those that are struggling. So this impacts healthcare, this impacts hospitals and healthcare providers, and they've been a big partner of mine and of state legislators around the country doing the important work on gun violence prevention. So thank you.
Thank you. All right. Now we're going to turn to you because I know there are still questions.
It's the end of the day.
Yes.
But
yes.
we can get in a couple questions and then we can get you out on time.
Okay. Who has a question? All right. I don't think we have them. Oh, I'm sorry. Yeah. We'll go back there first and then up here. Can you just project?
And we'll repeat the question. Okay.
I'm a certified peer and director of the Illinois War Line. I'm curious, the bill that passed exclusively excludes peer support and religious counseling. Can you clarify maybe the reasoning into that? Because at the heart of peer support is human-to-human connection, and I'd be worried that some startups might pivot and promote AI peer support rather than AI therapy.
Yeah, Jacob had a great question about there are a few exceptions and exclusions in the bill: peer support, religious institutions, calming exercises. We talked about that a lot. There were a number of efforts to expand the exception and exclusion list. There were a number of groups that were asking for those exceptions and exclusions. To me, my idea behind it was there are a lot of people that are, millions of people, that are using calming apps and different apps for a variety of supports, meditation supports, and that wasn't the target of the legislation. Your point is well taken, though, because peer-to-peer communications is a human contact. And again, it was derived that way, it was written that way, I think really to address some concerns from organizations that weren't the target of my legislation, but it's a really important point. I'm happy to go back and look at that.
Everyone. I'm Ami Campbell from Joslin. We're a community mental health center. You talked about access and why people turn to AI because it's hard to get access. A lot of what we talked about today in our sessions was workforce development and the workforce shortage. How are you thinking about the state investing in workforce development for healthcare professionals?
Everyone able to hear that? Great, thank you, Ami. That is something we've been working on for quite some time. Workforce development is, on one hand, a really fun catchphrase and something people throw around all the time as elected officials. And again, people in this room know that healthcare workforce development is a much longer runway than a lot of other professions. We've been investing quite a bit in behavioral healthcare workforce development, a lot of community college partnerships, investments, state funding of those programs from healthcare workforce development. And then there are federal issues in terms of creating new medical licenses for new med students. There's ways in which there's a lot of community colleges trying to start new programs for a variety of healthcare professions. And the other thing is that the state makes it really hard. We just make it hard for healthcare professionals. We're not paying them enough. If you want to be personal aid, or you want to be a social worker, or you want to be a nurse in a NICU, whatever you want to do as a healthcare professional, you're not doing it because you're trying to get rich. It's the wrong profession. It's a very, very hard, intensive, physically intensive profession. And so that just means we have to work harder. So we've made some good strides. And at the same time, we are in a bad spot. We, here in Chicago and the suburbs, we have a lot of specialists. We have a lot of access to care. There are a lot of parts of the state, just like most parts of the country, that don't. And that's something we deal with all the time. And the geographic challenges of downstate Illinois is very real. The desire of a nurse practitioner or a CRNA to go move to Southern Illinois, or an optometrist, and all the things that we take for granted sometimes, I think many parts of the state struggle with workforce shortages. So as a state rep, when we talk about our budget, when we talk about the IDFPR rules for licensure, the test taking, we spent a lot of time, I guess it was a year ago, looking at the licensure for LCPCs and then licensed professional counselors, that the multi-state exam, the national exam, was showing really, really significantly discriminatory racial results. So the exact same person, exact same education, a person of color had a significantly, it wasn't subtle, significantly higher likelihood of failing that exam. And we had to really be serious about what that meant and why that was happening. So there are a lot of things. That was a long answer, but I think it's because there are a lot of things that we need to do. It's not a single issue that we can, a single piece of legislation or funding that will solve it. It's going to take a comprehensive approach.
Other questions? It's a little hard to see the bright lights.
I know it's been a long day. No one wants to talk about transit funding?
Letitia.
Hi, Bob and Laura. So, what, as we think about, the multiple kind of fields of play that we're in this moment, what are some of the thoughts you have around how we collectively come together to be able to address some of these issues? How can we help our elected officials to have what they need to be able to stand the ground that we need and continue to support protecting Medicaid, building our workforce, doing all the things that we need to be doing in our state?
I could say we just stand together and we'll work together and we'll all be fine. I actually think what's about to happen is that the state of Illinois is going to become a further island amongst itself, which is not necessarily a horrible situation, and I'll explain. But what I think is going to happen is that Illinois is going to increasingly find itself in a real short turnaround time, having to create systems around our healthcare networks that we've never had to do before. The ways that the federal government has been a bridge across states, across systems, across types of healthcare and the healthcare continuum, I think has created something that for decades worked. I think that is not going to work anymore. The governor's executive order on vaccines was a great example of that. Anyone in the room who knows me has probably heard me say in the last 9 months that I think it's time for us to start exploring having a state-based FDA. And when I said it in January and February, and several of you in the room know who you are, you looked at me like I was crazy. And you were very kind. You didn't say I was crazy. You were just giving me that look. And I think the reality, though, is that as we start to look at our distribution of healthcare, whether it's vaccines or pediatricians or healthcare education or access with our safety nets and FQHCs, I think all of this is going to fall to us. And so I think it would be inappropriate for me to suggest that someone's going to save us. So I think the real answer to your question is, yeah, we're going to stand united. But more than that, I think we have to start to restructure our thinking about what's coming next and how we're going to deal with it. I really believe it's going to take us just changing the way we think about healthcare in Illinois. I've been doing healthcare for 20 years. Laura has been with me that whole time. Everyone in this room has been trained to think of healthcare as a state and federal partnership. I don't think we can think that way anymore and still deliver on the promise of healthy Illinois. I think we have to really reassess what we're doing. Some of that's going to have a direct fiscal cost, but those systems are all structured based on federal guidance and federal approval. And I think the sooner we start to acknowledge coming to 2026, 27, 28, that we are going to have to do it ourselves, the better we will have outcomes for the state of Illinois when other states are going to falter. So I don't mean to, again, go back to Skynet and Terminator. Sorry. But I really do. I'll close with the good news on that, which is I believe that Illinois has every tool that we need for that. Our county health departments are extraordinary. And that's not just in my home area of Lake and Cook. There are some amazing healthcare professionals throughout the state of Illinois that can step in and do this work. But it's going to take a very significant just retrofitting of our brains. And I believe that we can do it, but I also believe that it's coming and we have to do it.
Well, we wanted to end on a hopeful note, which I think we got back there. Yeah, we got back there. Given the amount of effort that's been put into today's discussion, the incredible dialogue that went on today. I mean, just really great, innovative thinking, a lot of focus on partnership. And as you can see, we have no shortage of state leaders who have our best interests in mind all the time. We appreciate your work, Bob, so much, and keep doing it, and know that there are lots of us here who are going to continue to partner with you and support that great work. So please join me in thanking Representative Bob Morgan for our fireside chat.
Thanks so much, Laura.
And I think I've been given leave to actually wrap us up. So that is the conclusion of our program for today. We really appreciate everyone's time, and we are looking forward to having you back here again next year for another great State of Reform. Thanks, everyone.